we're partnering with Bayer and the World Bank to provide virtual care services to communities that are struggling to get care by traditional means.
Welcome to Startup Health TV, where we celebrate the entrepreneurs and the innovators who are transforming health. I'm your host, Logan Plaster, here with Rafael López, the CEO and co-founder of Diagnostikare.
Hi, Logan.
Always good to see you. So you are innovating in telemedicine and digital health in Mexico. You've had some great big partnerships. You're doing great work down there. Kind of bring us up to speed in 2024, where things are at.
Yeah, it's been a transforming year for us, actually, with two significant partnerships that are helping us grow massively in the country. One is a very interesting one because it actually aligns with our mission on making healthcare more accessible and reaching as many people as we can. And this one is with Bayer, the pharmaceutical company, but with an arm called Better Life Army, which is an initiative led by Bayer and the World Bank to support smallholders and farmers and rural communities in southeast Mexico. So we're partnering with them to provide virtual care services to communities, as said, in the southeast region of Mexico that are struggling to get care by traditional means. For instance, farmers or smallholders, they typically take 2 hours to go to the closest healthcare facility or clinical setting. So,
which means they probably just avoid it as much as possible.
Exactly.
Who has time?
And it was impressive for us because when we were there last February to kick off the project, we actually thought people in those communities were going to feel a bit, reluctant to engaging into digital technologies to provide care. And it was completely the opposite.
Really?
They were queuing, expecting that the care services were going to be provided by the time we were to just promote the service. So the demand there is insane. And this will allow us, as the project starts rolling out and reaching other regions, to serve up to 500,000 people in those communities through the Bayer partnership.
So with Bayer and the World Bank, you're serving these rural farmers in southern Mexico.
Correct. Typically working on coffee growing.
So really kind of, when we think about access, pretty, inaccessible, kind of an extreme case. A rural farmer.
Inaccessible. In some cases, Bayer has actually have to set up Starlink internet connectivity, in order to make the connection feasible.
So this really is an example of what we describe as leapfrog innovation. You're really going all the way to an extreme rural situation, and then you're delivering high quality digital health. So talk to me about what the patient care experience, if I'm one of these rural farmers.
Great question, because we've actually had to streamline some of our key patient intake processes. Because a farmer's interaction with a cell phone might happen way less times than traditional people living in an urban setting. So we have to address our patient processes from the very beginning again to see what stages or what key touch points within the digital flow we were able to simplify and to make the whole experience way easier. Good for us. Most of the people in those regions have access to WhatsApp. They have a smartphone. Might not be the newest smartphone, but again, our technology is capable of delivering care even with low bandwidth settings.
But generally, people have a smartphone.
They do, and they know how to chat and they know how to interact with the smartphone. But we have to do a strong effort on making the whole, let's say, initial registration process way easier. In some cases, with support from some social workers at the facilities. These are kiosk facilities in those regions, and that's it's a whole transformation in terms of processes and technology to make sure that we are delivering.
Is this an experiment that Bayer or World Bank or Diagnostikare hopes to replicate elsewhere?
Absolutely, yeah. There's similar settings in Central America. Honduras, Costa Rica, a few other...
It's a big market.
A few other countries. It's a huge market. Obviously, if we make it in Mexico and if we prove it right, then we'll have the chance to go further down the continent to to
So this is
allow access to more people.
So this is an awesome example of you really taking to fruition your dream of bringing access. Tell me a couple things you've learned. The first one is that people are more ready for a digital healthcare transformation than maybe you thought they were. What else have you learned about just being on the ground, delivering care in such a rural setting?
I think there are some things that we have. I mean, when we started this business almost 5 years ago, a couple of things we took for granted, no, my brother and I, in terms of living in a massive cosmopolitan city like Mexico City and having the privilege to get access to digital tools and technologies, but then dealing with underserved communities makes you take a step back, even from, how can I say, an educational point of view in terms of saying what can be done and can't be done through digital health. And it's been about sharing our value proposition extremely clearly so that people can actually have clear expectations on what our service is capable of doing and what we're not capable of doing. Now, good for us is, I mean, the platform that we've developed and the capabilities that we have now allow to deal with almost 85-90% of the common primary care conditions, no, and that's an excellent setting for what we're doing. But still, it's taking a step back and being able to articulate properly for people that are not used to this digital world what are they capable of solving through our technology and our solution.
So part of it is a communications challenge.
Absolutely, there are some. This is amazing. Some of the regions that we've been working with, they've even had to translate our proposition into indigenous languages.
That's beautiful. That's a language. That's awesome. How does that make you feel?
I mean, when I heard that for the first time, I mean, I felt like literally, wow, never thought that.
Yeah, my work is being translated.
Exactly.
That's really cool.
In local languages.
So that's one really cool project. But you also are working in Mexico City. You've partnered.
Yes, we partner with the biggest insurance company in Mexico. This is also a massive game changer project for us. It's obviously a long time partnership. No, it's going to be taking place in different stages. But this is a very interesting one because this company covers up to 9 million policyholders. Wow. Not all of those 9 million are healthcare insured. It's all type of insurance, from life insurance to car insurance. They insure a lot of taxi drivers, for instance. Okay. And the prop there and the reason why this is going to be a game changer deal as well is because it will allow us to provide our virtual primary care prop for, let's say, people that, as long as they might have an insurance policy or coverage, they are still struggling to access care in traditional means. Yeah. So this is, again, putting our solution and our proposition in the hands of millions of people that might be a bit more digitized and they might be more used to dealing with smartphones or digital technologies, but still are struggling to get traditional care as someone would expect.
Since you're at the tip of the spear with virtual care, digital health, you're pushing care online. You're kind of pushing the envelope of what can be done over chat, what can be done over a video visit. Are there things that you've realized, you know what, we need to keep that in the clinic. We need to keep that in person. Have you had your perspective shift any?
Yeah, in a way. And before getting into that topic on detail, we did. I mean, this year was also critical for us because we got 2 ISO certifications. Okay. One to certify our clinical process with under quality management practices, mostly for obviously providing trust to our patients and to our partners and clients to let them know that we're following international standards when it comes to delivering care, even through virtual settings. The other certification that we achieved was on one key component of our platform to certify it as software as a medical device. So both certifications are critical for us when you are sharing and explaining what your platform is capable of doing on virtual settings. And then I guess what we've learned throughout this time is what are those key critical aspects that, as you were saying, have to be delivered, or you have to point out patients to those other points of care. One being lab testing facilities. No, we have a partnership with one of the biggest lab testing companies in Mexico, in which we're fully integrated. That allows us to issue lab test orders almost straight away from the platform, so that then people can show up at the lab test facility and get their lab test done. And we're also in good conversations with a couple of clinical centers we've done some pilot programs there, but it's now about taking them to the next level and stage, making sure that we could actually refer patients in a very much, seamless patient journey.
So it's not just about chatting with somebody, doing a quick video and getting like a prescription. You're also getting started on your care journey.
Yeah, in a way becoming that or care concierge or care coordinator for the patients that we treat.
What's the milestone that you're looking forward to most over the next, say, 6 months?
I mean, one is definitely finishing up the setup and these initial stages with our insurance deal, no? Because there's obviously lots of work to be done or pre-work before we can roll out to those millions of patients. We have a very strict time frame in which that needs to happen. So yeah, hopefully within 6 months' time, that part of our proposition will be live for at least 500,000 patients and counting. So
that's amazing. This is an exciting time. So I appreciate you taking the time, giving me this update.
Thanks for inviting me.
And we're going to be watching closely to see what you do next.
Excellent.
Love the great work.